Striking down the health care law may not strike away all the bill tied to that law, and there are lots of bills. There's a new report that says even if the High Court were to throw the whole thing out tomorrow, a lot of states would already be on the hook for billions of dollars worth of parts that have to be implemented just the same. Just another example of why Congressman Ron Paul says the government should not be in the health care business at all. But it is interesting, Congressman, you can't disentangle this very easily, even with a complete slapdown from the Supreme Court, huh?
No, it isn't going to be easy, and this is why the more complex the problems are that the government creates, the harder I try to figure a way how you transition out of them. And there is a way you can do this in medicine. It is a mess. You repeal this law, it's going to be messier. What I would say is just let people opt out. Always have a chance. You know, in education we say opt out, have private education at home education, get your taxes back on a tax credit. In medicine, it's the medical savings accounts. Let the patient control their funds. Let them have major medical. Let them deal with the doctor. So you have to introduce competition, allow people to opt out of the system completely. Just opting out of that mandate to buy private insurance, it's a good step, but that doesn't solve the whole problem. I want always a chance to use the free market if you want to, and the people in this country ought to have a right to do it.
You know, I'm wondering whether what I was mentioning with a prior guest, Congressman, that the comment I hear from a lot of CEOs and those who say, look, you got to kill this whole thing, not just the mandatory coverage thing, or else it lives on and entangles more. What do you say?
Well, I think there's some truth to that. The trouble is some of it has been put in motion. But, you know, there's still a lot of government involvement, even without this bill, and they'll never get rid of all of it. The courts never rule that way, so it's going to be messy. It'll be more complex. It's not going to be an up and down vote and say,
so you're
it's all
thinking
unconstitutional.
That, I understand, but what you seem to be saying is mandatory coverage aspect may go, which a lot of people said is the big chunk of it, but the much of it will still live on, and that's your fear, right?
I think so. That's generally the way things happen. They never really back off because they still, the principle by Republicans and Democrats is that the government should be involved in medicine. They don't come up with market solutions, so the courts are going to reflect that view. So there's not going to be a whole lot solved. Hopefully it'll help us a little bit.
You know, there's the argument politically to be made that a defeat or a shutdown like that for the president could be a campaign sort of clarion call. I tried to help you folks. I was trying to look after you. This Republican-packed court destroyed it for you, but I've got your back, et cetera, et cetera. Mm-hmm. What do you make of that?
Well, I think that's the case. I think everything is politicized, and there's a lot of demagoguery goes on, especially in election year, so expect it either way. So, oh, yes, if it's struck down or a major part is struck down, you're going to hear it from the Democrats that say, no, you know, medicine should be free for everybody. It's no problem. And people say, oh, yeah, that sounds like a good idea. No, there will be a lot of that, and it'll be politicized, and it'll be fought over for the next 2 or 3 months, and then they'll go back to patching it together, and we're still going to have too much government involvement in our personal and our economic lives. There's no doubt about that.
You know, during the presidential contest, Congressman, including having the honor of being a question in one of those debates, I always thought you were a special case because when it came to this issue, you're a doctor. You know of what you speak, and you know the hardships doctors deal with, and you know this better than I think anyone. And I guess if you don't mind, I ask you this just as a doctor. What happens now? Because let's say part of it is shot down, and we could be wrong, but let's say it is. A lot of doctors tell me premiums are still going to go up, choices are still going to be compromised, medical care and attention in this country is still going to be tested. And so with or without this, it's going to be a tough environment for doctors, period, for patients, period. Do you agree with that?
Yeah, I certainly do, and it's so messy now. But this started in the early 70s, you know, when they started these HMOs and PPOs, and they were done by mandates, and the tax code contributed to this. The legal system is all messed up on torts, and that is the mess. So, no, it isn't going to be cleared up. The patient is the one that suffers. You know, in a free market, The consumer should be king. It shouldn't be big business, and it shouldn't be unions, and it shouldn't be workers. It's always the consumer. In this case, the consumer is the patient, and the patient should dictate everything, should pick and choose and spend the money and negotiate, but they have lost total control, and the doctors don't care that much. What are they lobbying for up now is to make sure they don't get anything cut, or they're going to quit. And so they're not going to be satisfied, and doctors are. And they have to pay an undue price because of filling out all the forms. And so they make less money, and it takes all the fun out of medicine, believe me. But ultimately, the test should be, does it help the consumer? And in this case, no matter what happens tomorrow, the patient is still going to suffer.
You know, despite all these controversies, despite the weakening economy, the latest polls, as you know, Congressman, show the president ever so slightly widening his lead against Mitt Romney, but doing better in some of these battleground states. Are you surprised by that?
No, I think it's still too early to say much, because things, the nation and the problems are very fickle. You know, they're going to change from day to day. So I think this battle for November is just really getting started. So I don't know whether you read the polls today or tomorrow or next week will say as much as what's necessary. And what's the economy going to be like? Is it going to be worse, in the next couple of months? Is there going to be another war going on in Syria? Who knows what's going to happen? That's probably what will determine the outcome of the election.
Well, Congress, I know I'm not blowing you smoke, but I must say I think you elevated the debate this election year significantly and had a tremendous impact. And you're a very smart guy. Anyone who can get young people to applaud talking about the Federal Reserve is okay in my book. Okay in my book. Congressman, thank you very much. Good seeing you.
Thank you, Neil.
Ron Paul.